You're welcome again. This is your friend, No Solution. We want to talk about penile discoloration. Penile discoloration is caused by a handful of conditions, and penile vitiligo is just one of them. So, at times, when something happens to us, when you don't know the reason or probably the cause, you are scared. You understand? You need not to worry if the patches are discolored. You understand? As seen, most of the time it might go away, but if they stay, it is better you see a good sexologist in your area to make sure that there is no serious underlying condition indicated by the skin coloration on the skin of your penis. So let's dive into some of the causes of penile discoloration. Number one is injury to the penis. It can be penile melanosis. It can be contact dermatitis. It can be penile vitiligo, syphilis, penile cancer. Any of these conditions can cause the skin on the penis to change its color in small or large patches. Injury to the penis, when any part of the body is injured, the first thing that happens to the damage that happen is damage to the blood vessels under the skin of the penis, which can cause the blood flow out of the blood vessel, and it initially becomes dark as the blood cells die, leaving a dark spot on the skin. However, the dead cells are removed by the body, and spots will eventually lighten and then disappear. Such that spot or change in color due to any injury or a bruise or even due to the growth of a pimple on the penis may not indicate any medical condition and can be ignored, right? Unless the injury is really big or not healing on time. Then we're talking about penile melanosis. When too much of melanin, the pigment that gives color to our skin, get deposited in a particular spot, the area turns darker, leaving a spot. Such spots can occur on the skin of the penis, and condition is called penile melanosis. This too is nothing to worry about. It doesn't spread, it's not harmful. You wouldn't need any treatment for this unless you want the spot to be removed surgically. A cosmetic surgeon will be glad to do to do just that for you. You understand? Then, contact dermatitis. This condition develops as the skin reacts to allergens. Some may be allergic to a certain type of chemical, maybe used in soap or other cosmetics. Similarly, men who are allergic to chemicals or material used in a condom, the skin react by turning red and may become itchy and painful too. In serious cases, the skin may crack. So if it's just an itch reaction, you may wash off the area with mild soap and water and wait for some time. You may also take antihistamine to control the allergic reaction. But if the skin crack, you better see a doctor and get the right treatment. Then we have something we call lichen sclerosus. Light white patches of skin forming near the genital and anus is termed as lichen sclerosus. This condition can happen in both men and women. You understand? And women who are in post-menopausal stage are at higher risk. Men with lichen sclerosus is more seen in uncircumcised men. It may start with the foreskin but can spread to the rest of the penis and to the anal region. So some doctors may advise circumcision when they find the patches on the foreskin. And painful erection and decreased flow of urine are other symptoms of lichen sclerosus. Then let's talk about the vitiligo of the penis. This is just the opposite of penile melanosis. The condition in which white patches are formed on the skin of penis due to absence of low concentration of melatonin is called penile vitiligo or vitiligo of the penis. This is not a painful condition and does not spread to other parts of the body. So if you are okay with the patches, with the light patches which are typically near the foreskin, you can just ignore the condition. But you might want to get them treated when the spots are large in size. Steroids and other autoimmune-related medicine helps in restoring the color of the skin, darkening the vitiligo patches, so you can visit your doctor. What about syphilis? Syphilis is one of the bacterium caused sexually transmitted infection. Almost all bacterial infection is treatable. The most common ways of transmitting the disease is through unprotected, unsafe sex or by getting into contact with the sores or cords present on the infected person. Syphilis, if not treated, can affect the brain, the heart, other organs of the body. So symptoms of syphilis include development of sores near the mouth, genital or anus. On the syphilis move to a larger stage, you may have headaches, swollen limbs, node, fatigue, fever, weight loss, hair loss, and aching joint. Note that some symptoms resemble HIV and many other viral infections. So the soft form on the penis can change the color of the skin on the penis. Then what about penile cancer? This is not a common condition though. However, some men suffer penile cancer may not even realize that it is cancer. That's one reason why you should see a doctor if you notice anything unusual with any part of your body, not just your penis. The very first symptom of penile cancer is the change of color of the skin on your penis, and it is mostly the foreskin, and sometimes it can be the skin on the shaft of the penis as well. You understand? How can you treat this? Most of the time can include radiation therapy, chemotherapy, removal of skin on the penis wherever it is possible. Your doctor will be the right person to diagnose the stage of the cancer and recommend adequate and appropriate treatment. You remember, health is wealth. See you in the next video.